The chairman of the Independent National Electoral Commission, INEC, Professor Mahmood Yakubu, says that a panel has been set up to investigate the alleged issue of underage registration and voting in Kano State. He was speaking in Lagos at a workshop attended by the leading senior members of staff of the Commission on a retreat on the 2019 election project implementation. The decision to investigate the issue came after pictures of underage voters in Kano State showed children participating in local council elections on social media last weekend. What does this mean to the state and the act establishing the State Independent Electoral Commission? Data feeds are coming through in one place simultaneously on all our social media platforms, channelstv.com and on youtube.com/channels, where you can find our videos. Link up on the program now. You can tweet at Gimba Umar CTV and use the hashtag State of the Nation to air your thoughts on the subject. President Muhammadu Buhari has congratulated the South Africa's new president, Cyril Ramaphosa, and the African National Congress, the ANC, on Ramaphosa's inauguration as Jacob Zuma's successor, saying that he looks forward to working with him. Ramaphosa was elected by South Africa's parliament on Thursday and sworn in shortly after Jacob Zuma was forced to resign. Amidst increasing talks about whether President Muhammadu Buhari will seek re-election or not, the secretary to the federal government, Boss Mustafa, has said that there is no alternative to the president for the time being. The SGF, represented by the senior special assistant to the president on political matters, Gideon Samani, said this while addressing the pro-Buhari rally in Nigeria's capital, Abuja. Hundreds of protesters under the aegis of Democratic Youth Congress had converged on the Unity Fountain in Abuja, demanding that President Buhari seeks re-election. Former President Chief Olusegun Obasanjo has advised the president against going for another term, but the governor of Kaduna State, Nasir El-Rufai, asked him to contest. It's prime time here in Lagos, and this is State of the Nation. Welcome everyone in Nigeria and the rest of the world. I am Gimba Umar and this is State of the Nation. Be part of the show. Tweet at Gimba Umar CTV and use the hashtag State of the Nation to be part of the show. We're following very closely up on the biggest stories, one of which is the spread of Lassa fever, which has been recorded in quite a number of states in the Federation: Edo, Ondo, Bauchi, Nasarawa, Ebonyi, Anambra, Benue, Kogi, Imo and Lagos states. As at 21st of January 2018, the total number of confirmed cases is 61 and 16 deaths were also recorded. 10 health care workers have been infected in 4 states of Ebonyi with 7 cases, Nasarawa with 1, Kogi with 1 and Benue State with 1. But the Lagos State government has gone ahead to increase its alert level concerning this very important information that we're getting, and it has raised an alarm and ordered the surveillance of the virus in the state. Dr. Bakari Lawal is the Chief Executive Officer, EPID Alert. He joins us from our Abuja studios. I want to thank you so much indeed for coming on State of the Nation at this time. Lagos State government says that it is maintaining a high level of surveillance and activities through which this disease shouldn't see a loophole to spread. How concerned do you think the government of the country is at this time to contain the spread of Lassa fever?
Thank you very much and good evening once again. From all indications, the government of Nigeria is taking Lassa fever very seriously, at least from what we have seen as a stakeholder in the process. That was last week. There was a meeting here in Abuja. All commissioners of health gathered in one of the hotels in Abuja here to review the state of public health in Nigeria. And through that meeting, all the states were made to commit themselves to strengthening the process of Lassa fever control in Nigeria. So the meaning of this is, before now, I know as far back as May 2017, the federal government had commenced the process of ensuring prepositioning of resources in the state capitals to support the states and their institutions. So right now, I would say the federal government is doing their best in the process. But what we know is there's still a lot of work to be done. Lassa fever is currently becoming an endemic disease in Nigeria. moving into the same category as so many other diseases we've been dealing with in the past. So what it means is that government needs to change tactics, and the citizens also need to come to reality in terms of what we are dealing with. In the past, we used to think Lassa fever is an outbreak that just spikes up from time to time, but right now what we are dealing with is around the year we are recording cases of Lassa fever, and then we have to continue to deal with it that way till we are able to contain it definitively.
2017, let's go further back. Nigeria, indeed, hosted the heads of state of member countries of the African Union in April of 2001, where they all agreed to allocate at least 15% of their annual budget to improving their country's health sector. Now it spends about 340.45 billion in the 2018 budget. That's almost 20 years after the Abuja Declaration. What does this say of the government's efforts to improve healthcare in Nigeria?
Now, you got it right there. We need to prioritize our spend on health. This is towards achieving universal health coverage. The advocacy is strong, it's global, it's regional, it's national. And at the moment, Nigeria is still spending far less than the 15% we have been told we have agreed to participate in. However, there are also government initiatives ranging from like the Basic Healthcare Provision Fund, which the federal government should be launching this quarter according to statements that are out there. We hope with that we'll be able to create more access for primary healthcare, access to primary healthcare for citizens of Nigeria. But again, as it stands today, we are doing far, far below what we are expected to do. I think this advocacy needs to really go out there because, for instance, when we are dealing with things like Lassa fever and other outbreaks, they cost a lot of resources to set up the laboratory systems, to set up the personnel, to train, to build a treatment center, etc. These things cost money. And before now, we've enjoyed a lot of partner support from the likes of World Health Organization, UNICEF, etc. Nigeria needs to step up and lead in the financing of these processes. We are also a regional bloc. A lot of countries also rely on us. For instance, Nigeria houses the Regional Center for Disease Control in West Africa. The financing of the Nigerian health system even goes ahead to support the region. So Nigerian government really needs to step forward and really put the resources that will take care of the health of the citizens as a priority, because as it stands today, what we are getting is we are poorly financed as far as our healthcare system is concerned, and that is really, really, it's really showing in the way we implement the healthcare system.